Hello and welcome to 6 Minutes. I'm Gemma Collins. This week we look at what cuts to mental health items mean for GPs and their patients. The federal government announced in the May budget that it intends to slash MBS rebates as part of the cuts to the Better Access to Mental Health programme. It plans to introduce new time-based items that reduce Medicare rebates by 50%. But the announcement has been met with a major backlash from GP groups. We spoke to Sydney GP, Dr Liz Marles, who is Vice President of the Royal Australian College of GPs.
Well, my main concerns about the proposed cuts are that if we look at the big picture, it's taking $50 million out of mental health rebates for general practice in a year. And general practice is a perfect place, really, to deal with mental health issues in the community. Patients come to us for other reasons and we can detect it at that point in time. It's also non-stigmatising, non-labelling, so a lot of patients feel really comfortable about coming here. And I'm really concerned that with these cuts, GPs will not be able to deliver mental health services to the same extent that they have before. GPs will be basically faced with three choices. Either they'll they may want to continue providing the same service but will lose money doing so. They may choose to not bulk bill anymore, in which case, for the patients the access may become harder and the patients wind up paying more. Or else they'll try and spend less time doing it. And that's a concern to me, because I think it's been really good actually being remunerated appropriately for your time, and to be able to spend the time talking to patients, finding out what their issues are, really being able to target your interventions appropriately has been very worthwhile. I'm also aware of some practices that have funded the services of a psychologist in their practice through these item numbers. So they've been able to employ a psychologist who will bulk bill their patients, and then by getting the funding through the mental health plans, that's helped pay the costs of having the psychologist. And certainly Aboriginal medical services I'm aware of have done that, and some rural practices have also done that. And they're really important areas in terms of equity and access, and I'm concerned that those sorts of solutions won't be available to patients anymore. In my own surgery, I've got a number of patients who have quite significant need, and for them the reduction from 18 sessions down to 10 will be really significant in terms of their ability to get the amount of counselling that they need. I'm hoping that we will still be able to provide an appropriate service for them, but I'm very aware that some of these patients will not be getting the level of treatment that they have so far, and some have been doing really well with it as well. It's been fantastic for general practice to actually be able to access the services of psychologists for their patients. And it's really disappointing to see what has been a really good initiative that's been very widespread, because general practice covers almost the whole country, to actually be wound back in favour of more specialist services that won't be available to as many people.
Well, we expect to hear a lot more about this as the Senate inquiry into the cuts kicks off. 6 Minutes will be keeping you up to date with the latest developments, so stay tuned for that. I'm Gemma Collins. See you next week.